The Hepquant Shunt test is designed to assess the totality of liver function. The test results produce a disease severity index, or DSI, hepatic filtration rates, and shunt. DSI and hepatic filtration rates are measurements of global liver function and physiology. Shunt specifically addresses the development of collateral circulation and portal systemic shunting. Here's how it works. After taking a baseline blood draw, the patient is administered 2 doses of cholate simultaneously, 1 oral and 1 via IV injection. The oral dose is D4 cholate in a solution of sodium bicarbonate. This dose exits the stomach quickly and is absorbed in the upper small intestine by both passive and active transport mechanisms. Cholate is delivered to the portal vein via enterocyte transporters, binds to circulating albumin hydrophobically, and is presented in its first pass to the liver exclusively via the portal circulation. Simultaneously, 13C cholate is injected into the systemic circulation via a peripheral venous catheter. Cholate is cleared from blood solely via hepatic uptake, and the hepatic mechanisms for clearing cholate are identical for both 13C and D4 cholates. The clearances of 13C and D4 cholate are calculated from the area under the curve of blood concentrations of 5 blood samples obtained over 90 minutes. Hepatic filtration rates are calculated from the clearances, and both DSI and shunt are calculated from the hepatic filtration rates. In health, the portal vein supplies most of the blood to the liver. The acinus is the smallest functional unit of the liver, comprised of hepatocytes and a number of other cell types and supporting structures. Hepatocytes extract the cholate from the blood. A healthy liver removes about 80% of orally administered cholate from the portal blood in its first pass through the liver. The 20% of orally administered cholate that escapes extraction is delivered to the hepatic venous outflow for return to the heart and systemic circulation. In the Hepquant Shunt test, this spillover into the systemic circulation is detected by a slight increase in the cholate level in the blood samples obtained from a peripheral vein. To quantify shunt, it's necessary to compare the apparent clearances of both cholates. The Hepquant Shunt test achieves this by administering a known dose of 13C cholate via a peripheral vein and a known dose of D4 oral cholate. The clearance of the 13C IV cholate divided by the clearance of the D4 oral cholate quantifies the degree of portal systemic shunting. To summarize, there are 2 very unique and important measurements that are quantified in the Hepquant Shunt test: DSI and shunt. DSI quantifies hepatic function, and shunt quantifies the degree of portal systemic shunting. Both DSI and shunt correlate with the severity of chronic liver disease. Liver disease alters both hepatocyte function and portal circulation. Inflammation and fibrosis increase the resistance to inflow into the liver, reducing sinusoidal flow. In addition, the increase in resistance to portal inflow stimulates formation of collateral vessels or varices. This effect of liver disease is detected in the Hepquant Shunt test by an increase in the AUC of D4 cholate relative to the AUC of the 13C cholate from the peripheral blood samples. Varices are portal systemic shunts that develop as portal pressure increases in response to progressive fibrosing liver disease. The key is that shunting and varices are arising in parallel to the rise in portal pressure. The Hepquant Shunt test, which quantifies portal systemic shunt, is able to detect this change in the portal circulation. In studies, Hepquant Shunt correlates with both portal pressure and risk for varices. This is a key attribute of Hepquant: the potential to detect the patients who are at risk for varices, especially large esophageal varices, the varices that need treatment. Obviously, this is a very important clinical feature of Hepquant: detecting varices early. Varices are at risk for hemorrhage, an event associated with significant morbidity and mortality, and one that correlates with other complications of liver disease, including liver-related death. Our research suggests that the Hepquant Shunt test may provide valuable information in all stages of liver disease, regardless of the underlying cause. This graph indicates potential thresholds or cut points for disease transitions. Healthy persons typically have a DSI less than 12 and Shunt less than 30. It appears that the risk of additional complications of liver disease, such as ascites, encephalopathy, and liver-related death, increase in parallel with increases in DSI and Shunt. When the results of the test numbers are put on a graph, it looks like this. The red line is the clearance of the IV cholate. The blue line is the clearance of the oral cholate. In short, the smaller the area under the curves, the better the clearance and the better the liver function. Larger areas under these curves indicate lower clearance of cholate and poorer function. DSI is derived from the sum of the clearances. In contrast, Shunt is calculated from the ratio of the IV 13C cholate clearance to the oral D4 cholate clearance. The Hepquant Shunt test may identify thresholds above which the risk increases not only for varices, but also risk for other liver-related complications, including liver-related death and hepatocellular carcinoma. Hepquant's goal is to provide clinicians and providers of care to liver patients with tests of function and physiology to improve management and patient outcomes.